Hi. So how does the nurses take vitals on the system? It's pretty straightforward. Very first time you're logging into the application, something similar like this pop up, yeah? That shows you the branch, clinic, the location, and then the queue assignment mode, which I will explain briefly. Right? The branch is typically where you are, the branch you are in. Depends if the facility is a multi-branch facility, right? Any clinic you want to attend to, in this case, I'm saying orthopedic. Then your location. Um, this location is setup driven. We have you can define it. So on this currently we define consulting room 1 and 4. We can define other locations like vital area. You can define, maybe trias, any name you want to give it. All of this can be done from the setup, right? And we also have the queue assignment mode. The queue assignment mode is just a case where one system to automatically pick a patient for you based on priority, right? And then the manual is okay, we want the list to be open-ended, right? Automatic is first come, first serve. But manual is leave it open-ended, we can select the one we want. So if for this scenario, I'll be using the manual, so I click on submit, right? So it loads up my dashboard for me. I can see the waiting queue, the duration the patient has been waiting for on this queue. Then click on call patient. So the idea here is when you call a patient, it interacts with the active queue, which is the active queue management system, which is also a feature that helps with queue management at the facility, and it's mostly, you know, controlled by the front desk. But it depends on the hospital policy anyway, on who should handle that aspect. But there's a robust system for that. So when you call a patient, right, what you're just basically doing, telling the system is to inform, it should trigger the queue and say, and tell the patient to proceed to the vital area, right? That the nurse is waiting. Now, once the patient gets to the nurse, you can just click on attend. You click on yes, proceed. So when you click on attend, it just signifies that the patient is right in front of you and you want to take the vital of that person, right? And then it loads up this triage dashboard, right? Where we can see the vital history of the patient and even the vital charts, right? Then to take the vitals, right, we can just simply click on take vitals. Another beautiful thing is that this vital area we're looking at here, everything is setup driven. Both your minimum range, your maximum range, the values, the parameters, everything here are setup driven. It's something that can be done by the user, right? So and it's not just defining it. You can also do it for a specific age group. You can break it down up to the age group, like okay, from 1 month to 12 months. This is specific vitals want to be taken for these people, right? And all that can be defined from the setup. So for adults, these are the vitals want to be taken, right? And all on and like that. So we click on submit, right? And it says send patient to doctor immediately. Say yes, proceed, right? Now, it also gives you the ability to, if there's a need, right, to assign that patient to a specific doctor, right? You can then pick from here and pick that particular doctor. Otherwise, we can say, okay, see any available doctor, right? So the whole idea of this is that on the doctor's queue, if you use a specific, it takes the patient to that specific doctor, and only that doctor will see that patient. But if you leave it to any available, it displays this patient for all of the doctors on the queue to attend to. Here we just click on send. That is all, right? The vitals has been taken, the doctor will get to see that patient, and the nurse is being returned back to a dashboard to attend to other patients. There are also other functions like the recently seen, another queue, and all of that, which will be discussed later on. Thank you.